It's Ulrich Sidney, the President of the Association of Future African Neurosurgeons. I'm very happy to have everyone here this week once again. So this week we have a distinguished guest lecturer who will be presenting in a short while. As we always do, we'll present our panelists first. So Daniel Safari, can you please present yourself?
Hello, everyone. I'm Daniel Safari Nteranya. I'm a medical doctor from the eastern part of DRC. By now, I'm the chair of Incision DRC, and I'm a research associate at AFAN. Glad to be here this evening.
Thank you so much, Daniel. And then next up is David Urish Dale.
Hello, everyone. I am David Urish Dale. I am a first-year medical student in Russia. I'm equally a member of the communication team of AFAN.
Thank you, David. Next up, Darwin Sichimba.
Hello, everyone. My name is Darwin Sichimba. I'm a medical student at Upper University, and I'm a research fellow in the Department of Research of the Association of Future African Neurosurgeons. I'm glad to be here. Thank you.
Thank you very much, Darwin. And then next up on the list, we have Ndale Genevieve.
Hello, everyone. My name is Ndale Genevieve, fourth-year medical student, the University of Boya of Cameroon. I'm also a member of Communication Operation of AFAN. Thank you.
Thank you very much, Ndale. Olaoluwa Ezekiel Dada.
Greetings, everyone. I am Olaoluwa Ezekiel Dada, a second-year medical student from the University of Ibadan, Nigeria. I'm glad to be here.
Thank you very much. Then we have Wapri Senyoy. So I will just present. So Wapri Senyoy is a fourth-year medical student from the University of Boya in Cameroon. He's also a member of the Association of Future African Neurosurgeons. Next up we have Dr. Nuruddin.
Hi everyone, I am Dr. Nuruddin Bankole. I am Chief Resident in WFN Rabat Center, and I'm currently in France for internship. Nice to be here with you. I am also a fan member, and I am so glad to be here. Thank you, Ulrich.
Thank you, Dr. Nuru, for always being here. Next, we have Dr. Kennedy. Oh, he jumped off for his network. Okay, so thank you everyone for being here. This week we have a very interesting presentation by Dr. Sylvia Shitsama. Dr. Sylvia is a practicing neurosurgeon and lecturer at the School of Medicine, Jomo Kenyatta University in Kenya. She's a former clinical fellow of the University of Toronto, a very famous neurosurgery program both in North America and the world. And her clinical interests are skull-based lesions, degenerative spine diseases, medical education, and mentorship. So today, Dr. Sylvia Shitsama is going to present on mentorship in neurosurgery, which is one of the most requested themes and topics that we've had from our members. Please, Dr. Sylvia Shitsama, if you haven't already, unmute your mic and share your screen.
Thank you, Ulrich. Thank you, Association of Future African Neurosurgeons, for having given me this opportunity to present a topic that I'm passionate about on mentorship in neurosurgery. I'm also the mentorship coordinator at the School of Medicine where I lecture. And this position has given me an opportunity to look at it from a mentor perspective and a mentee perspective, and to be able to understand what are the challenges we face in each side. So I just decided to start the talk on the definition of who is a mentor. Where does the term mentorship come from? It actually originates from a Greek mythology about Odysseus, who was the king of Ithaca in the Trojan War. And when he went for this 10-year war, he left his wife, Penelope, and his son, Telemachus. And specifically his son, he left his son under the care of a mentor, whose main job was to guide him and take care of him while Odysseus was away, not able to do this particular job. But Odysseus left the wrong person in charge, because now Telemachus became insecure and confident in his ability to claim his birthright. He just wasn't, mentor wasn't doing a good job. And at the same time, other suitors were trying to get Penelope's attention so that they would ensure Telemachus would not get the opportunity to be the rightful heir. But it took Athena, the goddess of wisdom, to see what Mentor was doing and decided to empower Telemachus. And through him and his father, he was able to establish both his claim and his authority. And that's where the word mentor comes from, because that's what the particular job mentor was meant to do. So we ask ourselves, what is mentorship? There are three terms that come out. We have mentorship, we have coaching, we have sponsorship. And mentorship is really a relationship between a mentor or an individual who takes special interest in helping another person. And that person is a mentee, to develop into a successful person, to mentor them in various aspects of their life. But then we meet other definitions. We find coaching. What is coaching? Coaching is more a term commonly used in professional setting because it helps someone to help them grow in their profession. And the difference between mentorship and coaching is coaching, somebody is empowered to bring out the best in them in their professional career. And like mentorship looks at life in general, both professional and personal. Then who is a sponsor, or what is sponsorship? This phenomena is aptly put by Carla Harris, who's a vice chairperson of the Wealth Management and Senior Client Advisor at Morgan Stanley, who tells us that a person that is carrying your interest or who is willing to speak on your behalf about your abilities in a room and give you an opportunity to be given a chance to perform a particular role. And this boils down to all of us are always given an opportunity to talk at a table where decisions are made based on what is this person able to do, and there are objective measures to what is possible to the individual you're recommending. However, there's an element of subjectivity in this process, and that's where the sponsorship comes in. That is this individual able to pound the table on your behalf and say that I know Sylvia, and Sylvia is able to perform this, and you should be given a chance. That's what a sponsor is. So what are the areas we look at in mentorship? A mentor is able to motivate you, to guide you to success, to offer you direction, to coach you if you're looking only professionally, to offer support, be it personal or professionally, to help you develop your goals, and also facilitate you in training. Then we ask ourselves, why mentorship? Why mentorship in neurosurgery? The art of training neurosurgeons into competent and compassionate individuals is honestly a complex, multifaceted process that cannot be achieved by books and work hours alone. Highly successful people have shown that they have succeeded and reached where they are because of their mentors. Mentorship gives you an opportunity to use OPE, other people's experiences, to avoid work and personal development related pitfalls. Mentors will be aware of opportunities that can push you and give you a chance to grow your career, or also to evaluate your own personal life, or help you plan your career, or even network if you're interested in research. Mentorship also gives an opportunity for you to be able to have a long, well taken care of career, and even develops into friendship. Mentorship has been taunted as one of the things that can differentiate between an average and an illustrious career, because this person, using their experiences and other people's experiences, is able to guide you and show you what to avoid and what to pursue based on your goals and your intentions. There are various modes of mentorship that play a role in our lives. Collaborative mentorship is common back here at home because majority of the institutions use collaborative mentorship to partner with institutions from other parts of the world to offer training for neurosurgeons. We also have facilitative mentorship, distance mentorship, and virtual mentorship, which has now come out strongly due to the presence of COVID. I'm going to talk about peer mentoring and reverse mentorship, and then I'll discuss the rest in the subsequent slides. Now, some of us find it challenging approaching senior colleagues to mentor us, but peer mentoring has been shown to work, where it's a relationship between people at the same career level but one person has more experience in a particular domain and is able to provide support for a colleague. And in reverse mentorship, one is being mentored by someone younger than them. And this is very critical, especially currently when we have the world moving at a fast pace. And reverse mentorship offers a senior neurosurgeon or a senior colleague to appreciate the latest trends through the eyes of a junior colleague. And this gives them a chance and an opportunity to understand what are the upcoming residents experiencing, what are the junior consultants experiencing. This reverse mentorship is very critical in this way. Now, in collaborative mentorship, as I had mentioned, there are certain centers that have scarcity of local mentors, and that is something that has been noted in specific training centers, particular hospitals, and through collaboration with senior mentors from other hospitals or other institutions, facilitates training, allows peer and distance mentorship, and this leads to better professional outcomes, newer ideas, builds stronger research teams, and a network of collaborators that is useful in the growth of the individual surgeons in that particular center. Virtual mentorship has been in existence for a while, and the business community have utilized virtual mentorship. This is something that us, the medical community, have not taken it up. But COVID-19 has given us an opportunity to introspect and reflect on how we can use virtual mentorship. The biggest problem we have in terms of mentorship in the medical field has always been time. And virtual mentorship offers flexibility. So you're able to meet your mentor virtually, be it via Zoom, via Google Meet, at any time, very early in the morning before you do your cases, later after your cases, because you're not going to meet them physically. And this ensures you have consistency and continuity in this mentorship. And since time has always been an issue in the medical field, then virtual mentorship is going to provide the much needed gap to ensure mentorship is available to all that need it. So I look at people who have attributed mentorship to their success. Eliud Kipchoge is a Kenyan marathoner who broke the world record by running the marathon under 2 hours. To put it in perspective, he ran a kilometer for 2 minutes and 50 seconds. That has never been done. And when he was being interviewed about how he was able to do this, considering he had attempted this feat in 2018 at the Berlin Marathon, and he missed by 78 seconds. He also attempted it at the Nike project, and he missed it by 25 seconds. His first statement was, I attribute my success to my mentor and coach who has been with me for 14 years, who's seen me through it all. We have had challenges, we have argued over training, but his main aim was always to ensure I succeed. And I stand here having broken the world record because of my mentor. This shows the impact mentors have in our lives. In neurosurgery, we meet Harvey Cushing, who is known as the father of modern neurosurgery in the world. And there's this article written by Anthony Larson talks about the mentorship Cushing received from Dr. Osler, a Canadian physician, and in turn mentored Dr. Van Wanegen and the lessons that he drew from this mentorship. We are informed Osler and Cushing met in the 1900s, and they developed a friendship. Osler was known to be friendly. He had an open door policy. And when he met Cushing, he took a liking to Cushing. And even as he was a physician, he constantly referred patients to Cushing. And this built his confidence. He's always encouraged Cushing. Even after Cushing finished his residency, and Cushing wanted to settle down to practice, Cushing was the first person to encourage him and told him, kindly go to Europe and learn from the medical masters so that when you come back, you'll be ready to practice neurosurgery. And the lessons we drew from this relationship Osler and Cushing shared, that Osler was able to identify accurate recognition of Cushing's talent, that he was an excellent surgeon. He was able to offer Cushing's guidance at the time when he needed it. he was able to arrange opportunities, be it appointments at various hospitals or guiding him to go to Europe for extra sessions to learn, and also sustain this mentorship, because this friendship, they continued with this mentorship and friendship until Osler died. And Cushing, having learned from Osler, in turn taught Van Wanagen and others who came after him. So in neurosurgery, what are the roles mentors play in our lives? 4 themes come out clearly. Mentors become our role models. And when we look at it from neurosurgery, they are models in terms of offering technical support, and that is the business of neurosurgery. Are they teaching you the trade? Are they teaching you strategic thinking when you're operating? That this is how I do it, and this is how I avoid complications. If and when you get a complication, this is what I do to try and ensure the patient is not more harmed. They also help you in career planning and determining what else you need to do in your career. Should you take a year off for research? Should you take up the fellowship? Should you pursue the basic research, or do you want to go into device development? That is the role of your mentor. And they play a huge role in personal and emotional support in terms of work-life balance. So coming to the business of neurosurgery, and that's clinical mentorship, that's the surgical skills, and the academic mentorship, and that's the research aspect of neurosurgery. Clinical mentorship goes through from residency to junior consultant level to associate professor. As you clearly noted, Cushing's confidence was greatly enhanced by the belief Osler had in him. And at the level of residency, a resident is looking at developing autonomy, that I have the ability to operate. I have the confidence to operate. And a mentor plays a critical role in this, because they are able to show you, then they are able to work with you, then they are able to watch you as we operate, knowing that this is a renowned surgeon giving me an opportunity to operate on his patients, builds you, gives you a sense of autonomy and confidence. Now, at the level of the junior consultant, it gives you an opportunity to explore your limits, look at other clinical interests and allow you to accept challenges. The mentor is able to allow you to tolerate risks and help you define what particular field in surgery or in neurosurgery do I want to take. Do I want to go spine? Do I want to do vascular? Do I want to do endoscopic? And at the same time, reminding you of patient safety while challenging surgical boundaries. And as you get at the level of associate professor, then the mentor allows you to increasingly take up complex cases and ensure you work developing failure-free areas. And this several years of mentorship from residency all the way to associate professor and to full professorship grants you the opportunity to develop as a competent and adequate neurosurgeon. In academic mentoring, it's the exposure the mentor gives you to research. So you're able to perform research and at the same time participate in your clinical work. So at the level of residency, your mentor is able to allow you to do basic research and allow you to explore, be it you want to do basic research, do you want to do clinical research, do you want to do developmental device development? And once you've gotten the process of doing research, writing grants, writing proposals, writing theses, and you've developed your temperament, then they give you an opportunity to become a principal investigator. And you subsequently become independent and you know when to seek a mentor or when to detach and apply grants independently. A mentor plays a role in your career planning. Like I mentioned before, they advise you depending on your current situation. Are you a resident? What are your future goals? You want to finish the residency and do fellowship? They're able to discuss with you and give you an outsider's view in terms of should you pursue the fellowship now? Should you take a year off for research? And they discuss with you the pros and cons of academic neurosurgery vis-a-vis private practice. And that gives you an outsider's insights in terms of looking at it and see what will work in my situation. Am I more keen on work-life balance? Do I have time to delve deeper into clinical practice? That gives you an opportunity to view both sides from an outsider's insight. Now, during residency, we are always looking for opportunities to grow, be it in research, be it in your clinical career. You want to do fellowships, you want to do courses. The advantage a mentor has, he may have or she may have colleagues in other facilities and would know an upcoming opportunity, and is also able to increase your visibility outside your institution. So he or she is able to tell you of the next networking meeting, be it a continuous medical education. Now we have a lot of webinars and Zoom meetings, and your mentor or mentee is able to give you an opportunity to make a presentation and for people to know what you're capable of. And during these networking sessions, people are able to share best practices in terms of practicing neurosurgery, compare notes. What are you doing at your facility that is different from what we are doing at our facilities? This grants you an opportunity for potential collaborators, be it in research or in clinical care. You can run camps facilitated by various institutions due to relationships formed during these networking sessions. No individual is perfect in each field. And during this networking process, you're able to meet mentors who can better you in specific areas. Your mentor may be good in the business of neurosurgery, but you need a mentor in your personal and emotional support. You need a mentor who has experienced the challenges you're facing in terms of career planning. And at these networking meetings, you'll be able to meet these individuals who are able to guide you. A recent study done in the US showed a high rate of burnout among the neurosurgeons. It's depicted to be around 56.7%. And the number one independent factor that was noted to be contributing to this high rate of burnout was the inability to balance work in neurosurgery and life. And having a mentor gives you an opportunity to interact with an individual who has lived life and has been in the same situation as you. Is able to guide you. Do you have young children? Are you expecting a child? Do you intend to have children? Do you intend to get married? Are you having enough time with your parents? So they act as a sounding board for you to deflect, to talk to them about your ideas, and for them to give you advice based on their own experience or their other people's experiences and what worked and what didn't work. They also give you an opportunity, a reality check, and tell you, you may be overreaching at where you are in terms of your life, and this is contributing to your emotional or personal challenges. I had a conversation with one of the female neurosurgeons, and one of the advice I remember she gave me was, in life, there will be time you'll be able to do particular things, and there'll be time you'll have to stop doing certain things to meet other aspects in life. And this can only come from someone who has lived the life, experienced the challenges we're experiencing, and be able to give you a perspective from something she or he has experienced. Now, we have two forms of mentorship. We have formal mentorship and informal mentorship. Most organizations have informal mentorship where there's little structure and it's developed over friendship. And a mentor and a mentee self-select, that you identify a colleague you work with, you operate with, you do research with, and you decide this person will be your mentor. This type of mentorship normally doesn't have specific goals and doesn't have known outcomes. It's a relationship that can go on for years. And this is a relationship Osler and Cushing shared. However, programs have set up formal mentorship, which is structured programs that match a mentor and a mentee. These programs run for 9 to 12 months, and contracts are involved for accountability purposes. And in formal mentorship, we have established goals and measurable outcomes. The advantages of formal mentorship is that you as the mentee, you're able to establish, what do I want from this relationship? What do I need to gain from this relationship? What are the timelines? How are we going to go about it? What are the disadvantages? Sometimes You will have your specific goals. However, the mentor you've been matched with, that may not be their strength. Like I said, all of us have different strengths. And this may be at a disadvantage to you because at the end of the mentorship period, then your goals have not been met. And like in an informal mentorship, then you have lifetime friendship and you're able to address majority of your goals, albeit them not being specific. You are the driver of this relationship, and you know, I know this colleague of mine, I know her, I know him, and this is what they are good at. And I want to know how they are doing it to learn and become better. So we look at it from a mentee perspective and a mentor perspective. From a mentee perspective, the first question you ask yourself, you have to be prepared. Why do you want to be mentored? You always have to start with the end in mind. You have to have a meeting with yourself and discuss your own strengths. What are my strengths? I know I'm very good at operating. If I'm taught once, I get it. I've been to several courses, I'm good at it. What are my weaknesses? I'm not good at networking, yet I have interest in research. What specific skills do I want to learn? Do I want to go back to school and learn more about research? Do I want to participate in clinical research, in basic research? And what are my ultimate goals? At the end of the residency, do I want to go for a year in research or a year in fellowship? And how much time am I willing to dedicate in this mentor-mentee relationship? Because at the end of the day, you want to be a student and not a follower. And most of the time, the mentor will assume that whatever they give you, you should follow. That's a followership. You need to be a student. Take the information from the mentor, synthesize it in your current situation, and see how it helps you. And what skills do you already have? Because nobody comes as an empty vessel. Everybody comes with particular skills. You just want to augment the skills. And having had this small meeting with yourself, then you know you're ready to be mentored. And what are you looking for in a mentee, in a mentor? You're looking for someone who is a good fit. And who is a good fit? This is someone who will help you build a strategy that is good for your needs, who will look at your skills and your desires and push you to be a better version of yourself, not a mini version of themselves, being a student and not a follower. And they are willing to use their experiences to teach you, meaning they are willing to talk about their failures and their successes, because there's no one who has not experienced failure. Because you don't want to find yourself in a situation where you're believing my mentor has never failed, then how is this working? Because I have come with this failure and I needed to understand how am I able to get past this challenge. You look for a mentor who is truthful and respectful. And this is an individual who is able to give you honest feedback and tell you, this, you did it right. This, consider doing A and B. Somebody who is an expert in the field, you need mentorship. Do you want a mentorship in the business of neurosurgery, specifically spine? Are you being mentored by a spine surgeon? Are you being mentored by a vascular surgeon? That ensures whatever you're looking for in a mentorship, you get it. Then you want to ask yourself, is the mentor invested in their own growth? Do they also want to learn to improve themselves? Then you know they are invested in their own career and they'll truly be invested in your own. As a mentee, you are the driver of the relationship because you have developed your goals, having had a meeting with yourself, and you know what you're looking for. So you own the relationship, you set up the meetings, you send the agenda, and be prepared for each meeting. 24 hours before the meeting, write down and ask yourself, in our next formal meeting, I want us to talk about A, B, C. That gives the mentor an opportunity to prepare, to introspect, to reflect on the experiences they've had that may have an impact on your goals, rather than them showing up for a meeting and finding goals and they might not remember everything just off the bat of their mind. So having this preparation gives you an opportunity to know what are we going to cover and the experiences me as the mentor or you as the mentor want to bring on the table. As a mentee, you should keep the relationship professional. Very critical, especially when discussing matters related to work-life balance, emotional and personal support. That at some point, the mentor would recommend listening to the challenges you're facing. I would recommend you see a psychologist or a psychiatrist. Be open to the feedback you're giving, because his aim is to make you a better person, a better version of yourself, and looking at it from his or her perspective and getting you out of your comfort zone. As a mentee, you should be willing to share your progress. What has worked in the relationship you've been having? What hasn't worked? What areas are still challenging? The advice the mentor has given you, what have you implemented? Where have you met obstacles? And what suggestions would the mentor be willing to give? Always be open to your mentor, because then that's the only way they're able to offer you advice or act as a sounding board to the challenges you're experiencing. A mentor is dedicating time off their busy schedule. Doctors are known to say, we are busy, we are busy. Be gracious, keep time, utilize the time well. And after you've been mentored, take the opportunity to pay it forward, be it through peer mentorship or even mentoring younger people who have not come to medical school, who are in high school. They always remember the impact you had in their lives. And looking at it from a mentor perspective, most people I meet will tell me, I wasn't mentored. Why should I mentor? I turned out okay. I'm successful in my career. Mentorship gives you an opportunity to see things differently. It always broadens your horizon and look at other people's situations differently. And this is very important to improve. We all have our set habits, be it professionally or personally. And when you constantly interact with individuals and mentor individuals, it gives you an opportunity to understand why you take life as it is, vis-a-vis how others look at life. And when you're giving advice, you're looking at this or offering advice based on your experiences, and you're better prepared or better knowledgeable on how you're living your own life. As we grow in the profession, leadership has a way of arriving at your doorstep. And there's nothing bad than leadership arriving at your doorstep and you've not prepared for it. Mentorship gives you an opportunity to prepare for this because you interact with people of all spheres. It gives you an environment to improve your communication skills, how to work with others, how to look at different perspectives and be willing to learn, because from mentorship, I'm learning as a mentor, I'm learning as a mentee. It gives me an opportunity to learn and progress, which are important skills in the leadership opportunities that are coming ahead. It also gives you an opportunity to put the experiences you've had into perspective as you share them. Some of the experiences we've had may not have had an impact in your life until you meet a mentee who has had a similar experience. Then you introspect and reflect and realize that particular experience had this impact in my life. And you sharing how you went through that experience and how you dealt with the situation would be an opportunity to give another one a chance to grow. Mentorship gives you an opportunity to change someone's life because you're able to review their career, engage with someone who has an entirely different background from you. And this is immensely rewarding to both you, the mentor, and you, the mentee. And those are the 5 key reasons that if you've never thought of mentoring, you should reflect and say, it may take my time, but it's changing the generation coming. It's going to impact on the ones ahead of me and the ones behind me. As you prepare yourself as a mentor, what should be the things that should stand out? As a mentor, you should have a desire to help people. Always that you're looking out to, how else can I make this person's life better by the information I share, be it the books I read, the courses I have attended as a neurosurgeon, the research I have discovered, the research courses, bringing them on board as research assistants, as co-authors to papers, gives this individual an opportunity to see how research is done and may develop, making them to become outstanding researchers and give them an opportunity to discover something they didn't know. As a mentor, you should be willing to dedicate time and energy to this mentoring relationship. It does take time, but it will be rewarding. Being passionate and dedicated to mentoring is always fulfilling. And always remember, people are not the same. Two career paths are never the same. Teach, but be always ready to listen and learn. Because you may learn, as I talked about reverse mentorship, you may also learn from your mentee. A mentor should have a deep understanding of the subject matter. And if you don't have a deep understanding of the subject matter, never hesitate to talk to the mentee and say, this is not my area of expertise, but I know Dr. So-and-so, who's an expert in this field, and will be able to guide you well and refer them appropriately. Have a growth mindset. Every day something new is coming. Every day we make mistakes. Every day we learn from our successes and our failures. Be a curious student as a mentor and read vastly. Be respectful. The mentee will share with you personal information that they may not want to listen or hear it from someone else. This is your opportunity to learn confidentiality. And like I talk, what Kalahari says, be willing to be a sponsor because you know your mentee. And if you're sitting at a decision table and an opportunity has come up, be willing to use your power, will your power, and give this mentee an opportunity to grow. As a mentor, there are two critical skills that you should have: active listening and feedback. Most of the times we talk to different people, but you can tell they're not actively listening. And our brain can make us assume that whatever I was told, I'll be able to remember. Always remember, your mentee is not an empty vessel for you to pour all the knowledge. They also have ideas that they would like to share with you. So give them an opportunity. Listen to what your mentee is telling you. Paraphrase what they have told you to be sure you have captured what they are talking about. And in certain instances, write it down because they may be talking for 10, 15 minutes and you might not remember clearly what they said at the beginning. And when you have written down, as you're giving feedback based on what they say, encouraging them to be students. And this gives them an opportunity to grow. Now, as you're addressing the goals the mentee has set, the coaching fraternity has come up with the GROW model, which looks at it in terms of what goals have been set, what's the reality, what options are available to your mentee, and then you're able to wrap up and determine what's the way forward. So as you're talking to your mentee, you're looking at it. What are the key areas of concern? What should we focus on? What should I be specific with? Considering we are in a formal mentorship and we may be constrained with time. And what is the reality? What is happening now? My goals may be to get to point A, but the reality, I don't have funds for it. What is available to me now? What have I tried? Have I applied grants? Have I applied travel grants? And what options are available to me? Have I tried these options? Have they been a solution? And after you've discussed the issue and come up with possible solutions, then you write down what will be the next step, moving forward, and how we do follow-up, and how else as a mentor, you can support your mentee in achieving this particular goal. Now, as a mentor and as a mentee, we are all happy when people support us and cheer us on when we achieve the things we achieve, be it professionally or personally. But if you don't get feedback or if you don't get constructive criticism, then you will not be open to growth. A good mentor will know how to deliver feedback in a way that is kind and direct and doesn't shy away from being honest because they're going to hurt your feelings. Because at the end of the day, Their aim is to make you to grow. And us as mentees, we should have room for receiving this feedback and knowing that my mentor is giving me this feedback to make me a better version of myself, to improve myself career-wise, to improve myself personally, to help me in networking, to help me plan my career. Various models of feedback have been given. One I've always used is the sandwich feedback. I know others use different models. In the sandwich feedback, you give positive feedback, then you follow with a statement of constructive feedback, and you wrap it up with positive feedback. The importance of the sandwich feedback, as human beings, we always remember the worst that was said. You may have had an excellent presentation, be it in exams, when we go for OSCE, we go for Vivas, you answer all the questions correctly, and the one question you didn't get correct at the end of the Viva or OSCE is all you will remember. But if the sandwich feedback emphasizes on what you did well, sandwiching the constructive criticism in between positive feedback. And this I have seen has been very useful, especially to my students that I lecture here at Jomo Kenyatta University of Agriculture and Technology. So as a mentee, you have identified the goals. You've had a meeting with yourself. You have decided this is the area I want to be mentored in. And now you're ready for your first meeting. You've already identified the mentor, and you're now ready to start your mentorship. What should the mentor do in the first meeting? Always remember, as a mentor, you have an upper hand. Because the mentee is scared of you sometimes. They're like, this is a senior neurosurgeon, is a senior colleague. What am I going to talk to them about? They might think the challenges I have are not worth their salt. It is your opportunity to make the mentee at ease. And this gives you an opportunity to have seamless mentorship. How are you able to do this? The first meeting, in the first 30 minutes, talk about your life. What are your interests, your professional interests, your personal interests, your shared hobbies? You may find, I love tennis and my mentee loves tennis. We may share on when tennis is played, or when is the next game, when is the next tournament. This acts as an icebreaker and gives you the opportunity to also hear about the mentee's life, their personal and professional interests. As a mentor, this gives you an opportunity to do what we call an informal need assessment. You're able to tell, okay, maybe my mentee needs mentorship in this and this area based on what I'm hearing. And during this first meeting, you're able to set goals that mutually, and you agree that these are the areas we're going to work on. You're able to set a schedule, be it being specific about the date, time, and venue. I find this very important because we all have Google Calendars. You're able to schedule, and I know every first Monday of the month, I have mentorship, or every first Monday of the quarter, I have mentorship. That way, if something comes up, then I know, no, this time is protected for mentorship. Allow the mentor to make the final decision because it is his or her goals you're working on. Be accountable to each other. If an assignment has been given to you, the mentee, follow through it so that your mentor can know, have you worked on the issue? Has it resolved? Has it been useful? Did you encounter obstacles? What did you do with these obstacles? Always check your biases as a mentee. What you see on the outside may not necessarily be what is on the inside. So don't look at how someone is dressed or how someone presents themselves to you and assume that's what they represent. Always maintain a professional relationship. Like I said, you have the upper hand. Be the one pushing for a professional relationship, not blurring the lines between professional and personal. From a mentee perspective, you have identified your mentor. Like I said, it's good to write them an email and say this, in the first meeting, write them an email and inform them that we are going to meet in the next 24 hours at this time. And after you've identified your goals and you've established the rapport, similar to what you did with a mentor, you have a common ground, you have shared hobbies, relevant career and social history, and you've identified your goals and objectives, then you're able to move into subsequent meetings. And in subsequent meetings, it's good to say, last time we talked about my career planning, I've decided to do research, or we are going to talk about this, so that as the mentor, I come prepared knowing this is what we are going to discuss. And 72 hours after our meeting, because both of us have to follow up, you the mentee, me the mentor, so that I'm aware this is what we discussed, this is what we will follow up. I was to get you in touch with a colleague who is an expert in research, an expert in endovascular, so that I, as a mentor, am able to do my role, and you, as a mentee, you're able to do your role. And after your first meeting, you should have defined goals, how you're measuring these goals, and the responsibility allocated to both the mentor and the mentee. And if you have challenges, because there's nothing that is perfect, how do you address the stumbling blocks? We may agree with a mentor or a mentee, this is what is going to be done, and the mentee does not follow through. Or me, the mentor, I was supposed to talk to a colleague to mentor you, and I haven't. How do we address these stumbling blocks? Because we are both working to get the better version of the mentee and also the mentor. And what is our work plan for achieving and learning in the learning goals that we have identified? This should come out very clearly. A mentoring partnership agreement puts in writing what we have agreed. That we have agreed we are going to work specific times, meet regularly. It keeps me, the mentor, or the mentee committed. It keeps the content of our conversations confidential. Only if I feel whatever we have discussed is detrimental to another person's life or the life of the mentee will I divulge the information discussed in our meetings. It gives the mentor an opportunity to practice active listening, be it paraphrasing or noting down what the mentee has talked about, and how this will help in refining the goals that will be developed and maintaining honest and respectful feedback. And this is commonly used in programs that have formal mentorship, and both the mentor and the mentee sign. Sometimes the mentor may be talking, and in his opinion or in her opinion, they are helping the mentee. But what the mentee is getting is totally different from what the mentor envisioned or what the mentee envisioned. So what do we do when the mentorship is not working? As the mentee, I ask myself, did I articulate my expectations and my needs well? Maybe the mentor didn't get what we wanted to discuss. If I articulated my needs and expectations well, and as a mentee, I feel my needs and expectations are not met, then it would not be proper for time to go on and you feel you're not getting the appropriate mentorship. And the best way, because you had already addressed how to deal with such stumbling blocks, is to be transparent and honest with the mentor and say, I was looking forward to this mentorship. However, my goals are A, B, C, and I would like to change a mentor so that these particular goals are met. However, don't end the relationship in a sour manner, because you don't know if you're going to meet this particular mentor in future. So as Cram, who is known and who have written a lot of articles regarding mentorship, talks about gratitude being key to living gracefully, that you don't want to sever a relation that you may need 2 years from now, even 20 years from now. In formal mentorship, we must prepare the end of the relationship. And you need to give advance notice and say, I was here for mentorship for 1 year, or we signed up a mentorship contract for 1 year, and it's almost 2 months to the end of this mentorship. First is to evaluate, have we achieved our goals? What did we achieve? What didn't we achieve? If we achieved everything, then what are my future goals? Your mentor can teach you or help you set up your future goals, and even set you up and connect you to future mentors to the next facility you're going, or to the same facility you're in. Or as a mentor and mentee, you may decide, we enjoyed our relationship, our working relationship this year, and we would like to extend the mentorship into a second year. And like I talked about, the ice-breaking moment, you may realize you have shared hobbies And this may move from being a formal mentorship to informal and even build lifelong relations. Always be open to this. In mentorship, keep it simple. Don't make it complex. Take small bits at a time. Every system that was developed or that has been developed, be it a car, an aeroplane, has always started from a simple system. The minute you complicate it, then you lose the value in the mentorship. If it's building your professional pathway, be as simple as possible in what you mean by professional. It could be, I want to learn how to do craniotomy. What particular craniotomy? Be specific. That way, it ensures that you're able to meet your goals and you're able to know what is working and what is not working. In the medical world, effective mentorship has faced very many challenges. In the studies that have been done regarding effective mentorship in neurosurgery, in surgery in particular, and even in medicine, time has always been an issue. In most institutions, in most hospitals or training programs, protected time for mentorship, both for faculty and residents, has not been set aside. And this has played a bigger role in the reduced uptake of mentorship. Faculty accepting to be mentors or to even be mentored. And some people would say, I wasn't mentored and I was okay. But the impact of mentorship has been shared by world over leaders and successful people who have known and have shown the importance of mentorship. Residents also have a similar mentality and say, mentorship is taking up my time. Neurosurgery is already rigorous in itself. I can't spare an hour or two for mentorship. The challenge with this kind of mentality denies you the opportunity of growth because there's no one who knows everything. All of us have deficiencies in one area or the other, and we are all lifetime students. And mentorship gives you an opportunity for this growth. Most organizations do not have structure. As I was doing my fellowship, I noted my training center had protected time. And when this protected time came for mentorship, whether the resident was busy or not, they were very keen on keeping this time. And I thought that's why their mentorship program must be working, because the protected time is protected and the mentor and the mentee are available for that particular service. So the fact that there are no structures regarding mentorship programs, be it in our hospitals or in our training institutions, is a great impediment to the development of mentorship in neurosurgery. Lack of clarity in both goals and roles. And that's what I've been talking about. What is your role as a mentor? What is your role as a mentee? Are you aware those are your roles? As a mentee, why do you need mentorship? You just don't go to the office and say, I want to be mentored. The mentor would say, about what? Because then you're putting yourself in a position to become a follower and not a student. Then they're only going to teach you to be a mini versions of themselves and not a better version of yourself. Personal factors, relational difficulties, and institutional barriers have also played this role in barriers to effective mentorship. What are the solutions to mentorship in our institutions? Number one, if your institution does not have a mentorship program, be the greatest advocate of mentorship program. In my institution, this is the second year we are having a formal mentorship program. And it took the initiative of myself and my colleagues to ensure that the systems were put in place. Is it perfect? No. It is work in progress. And I know 5 years from now, 10 years from now, we'll reflect on what we started 2 years ago and the impact it would have had on the medical students we encounter every single day. Determine the elements of mentorship training in programs that are already doing mentorship, the successful elements, and come and plug them into your program. Evaluate these programs from the mentor and mentee perspective with the hope of improving them and making them better. And empower mentors and mentees through training for effective mentorship. There are always several courses on how to become a good mentor in the medical field. Various institutions have started various courses on medical education and mentorship. Take them up. Most of them take you an hour, some at most 2 hours. And there are various articles written on mentorship. Take the opportunity to read and understand how mentorship is changing lives and how we can plug mentorship into neurosurgery to make neurosurgery better. Remember, it's not what you get from mentorship, it's who you become with mentorship. You become an excellent surgeon because they're teaching you the business of neurosurgery. You become a great educator because you're being taught the academic aspect of neurosurgery. You become a great mentor and also a great mentee. Give mentorship a chance. So that's Kenya for you. We are the only country with a national park in the city. So in the background, you can appreciate that's Nairobi, that's our capital city. And just you're able to see the lions. Thank you so much.
Wow. Thank you so much, Dr. Sylvia Shitsama. I think one of the things that epitomizes the quality of this presentation is that I saw people writing questions in the group, and as you went through your presentation, your slides, we got messages saying, oh, this question has been answered, sorry, because it was that comprehensive. You can see that in the commentaries. Honestly, I appreciate that you went through the perspective of the mentor, the perspective of the mentee, and it's something that has come up so many times. We've had so many people asking, how do I get a mentor? What do I expect from a mentor? And you covered everything. Thank you so much for taking the time to do this.
Thank you so much. It was a pleasure to give this talk. It's always been a topic I'm passionate about, and I'm glad that it has had such an impact. I can see someone has shared Kalahari's talk. It's a very powerful talk. You should listen to it. And remember, if you're sitting at a decision table, always use the opportunity to grow someone else.
Yeah, totally agree. So I'll just read a few of those that, so one of the questions comes from Dr. Daniel Safari, who asked, is it okay for an aspiring neurosurgeon to have a mentor who's in another field other than neurosurgery?
Yes, it is. As I mentioned, we all have our strengths and weaknesses, and it's very difficult to find someone who's perfect in all fields, in all 4 aspects that I talked about. And when you identify someone outside the field, it also gives you an opportunity to look at it from an outsider's perspective. Because when you're only talking to neurosurgeons, we interact, we only look at it as a neurosurgeon. But when someone else outside the field gives you their perspective, then it changes how you look at that challenge you're having and gives you a different perspective.
Yeah, thank you so much. And then a follow-up question to that. This one is from Olaoluwa Ezekiel. The question is, how many mentors is okay? Is it okay to go all the way to 2, 3, or is there a limit to how many mentors you can have?
There's no limit to the number of mentors you can have. The only challenge is, would you have the time to meet all these mentors? Number 1. Mm-hmm. Number 2, what if they're giving you conflicting views of different perspectives? 1, 2 mentors, okay. More than 3, I think your plate will be full. So what I would advise, you once you've identified your goals, and putting it simply, I say this 2020, I'm going to work on research. I deal with it. Then I get it over. I move to the next issue. But if I feel I need to deal with 2 simultaneous issues, just to ensure I'm not getting overwhelmed by the number of meetings and the number of follow-ups I need to do in terms of my 2 or 3 mentors are giving me connections or getting me connected to various, I need to attend courses, I need to take up a program, then I feel I'm already overwhelmed and I'm not able to take up my duties as a resident or a consultant or a medical student.
Yeah, thanks. We keep getting the congratulatory messages, and one of the key messages here is from Dr. Ignatius Esene. For those who don't know Dr. Ignatius, he's the president of the Young CANS and the co-chair of the Young Neurosurgeons Forum of WFNS, a great supporter of our group. Definitely one of those marquee mentors that we count on the continent.
Thank you so much, Esene. I've known Dr. Esene since my residency days, and he's been a peer mentor, and that's why I recognize peer mentors a lot.
Thanks. I'd say perhaps a final question on this is, in approaching mentors, one of the difficulties, like you mentioned, is that hierarchy in neurosurgery, but especially in the African culture. So we have had a few folks find difficulties with those, and in the practicalities of getting to meet that person and getting them to see you or give you that opportunity. What are some tips? Obviously, you mentioned about having shared interest and everything, but what are some tips maybe in the way you should address the person, the media you should use to address the person to get that first meeting?
Okay, so majority of the mentors you get, especially at the residency level, would be the people you work with, the consultants who are teaching you. So if you continuously attend their cases, it builds a rapport. It gives you an opportunity to develop some form of rapport and friendship that you're able to bridge and bring up the conversation of, excuse me, Ulrich, Dr. Ulrich, I would want you to mentor me. The other is the conferences and networking sessions that we go for. If I go for this particular mentorship meeting or this conference and I meet, let's say, Professor Kazadi Kalangu, next time I meet him again, I say hi to him and gives me an opportunity. He remembers, oh, Dr. Shitsama, we met here and there. And then you say, okay, Professor, I would like you to mentor me. So it's the courage to ask it. Because I always tell people, the worst somebody can say is no. They only have two answers. They say yes or no.
Yes, thank you so much. And talking about Professor Kazadi Kalango, he was here a couple of weeks ago, and he said, we are Africans. If you don't have an uncle, nominate one. If you don't have a mentor, nominate one. And an analogy from sports is you miss 100% of the shots you don't take. If you don't take a shot, then you don't make it. So you have to take your shot, and hopefully you're going to find the right person to mentor you.
Yes.
Wow, thank you so much for this session. This was amazing, wonderful. Like we said, we've recorded the session. We're going to upload it onto our YouTube channel and share the link with everyone. We had so many people come in late, and they were already asking us if they could have access to the presentation. So we'll share the link with them. We'll equally share the contacts for Dr. Sylvia Shitsama so that you can reach out to her if you have any further questions. Thank you so much, everyone, for coming today, and have a great weekend.
Thank you so much.
Hey, Sylvia.
Yes, I said it.
Wow, that was an excellent talk.
Thank you so much. Thank you.